Question 1. A client with chronic kidney disease is admitted with potassium of 6.3 milliequivalents per liter and peaked T waves on ECG. Which provider order should the nurse implement first? A. Administer sodium polystyrene sulfonate. B. Prepare client for hemodialysis. C. Administer IV calcium gluconate. D. Administer IV regular insulin with dextrose. Answer is C. Administer IV calcium gluconate. Rationale: calcium gluconate stabilizes the cardiac membrane and prevents lethal dysrhythmias. It does not lower potassium, but it is the priority with ECG changes. Question 2. A client with COPD is receiving oxygen at 4 liters per minute via nasal cannula. ABGs show pH 7.30, PaCO2 60 millimeters mercury, PaO2 72 millimeters mercury. Which action is most appropriate? A. Increase oxygen to 6 liters per minute. B. Switch to non-rebreather mask. C. Continue current oxygen therapy. D. Discontinue oxygen therapy. Answer is C. Continue oxygen therapy. Rationale: the client has compensated respiratory acidosis typical in COPD. Increasing oxygen may suppress respiratory drive. Question 3. A client with heart failure reports sudden shortness of breath and frothy pink sputum. Which intervention should the nurse implement immediately? A. Administer IV morphine. B. Place client in high Fowler's position. C. Prepare for intubation. D. Administer IV furosemide. Answer is B. Place client in high Fowler's position. Rationale: positioning reduces venous return and improves gas exchange. It is the fastest immediate intervention. Question 4. A post-operative client receiving PCA morphine has a respiratory rate of 8 per minute. What is the nurse's priority action? A. Decrease PCA dose. B. Administer naloxone. C. Apply oxygen. D. Stimulate the client. Answer is B. Administer naloxone. Rationale: respiratory depression is life-threatening. Naloxone reverses opioid effects immediately. Question 5. A client with cirrhosis develops confusion and asterixis. Which lab finding explains this change? A. Decreased albumin. B. Elevated bilirubin. C. Elevated ammonia. D. Prolonged INR. Answer is C. Elevated ammonia. Rationale: hepatic encephalopathy results from ammonia accumulation due to impaired liver detoxification. Question 6. A client with diabetes insipidus is most at risk for which complication? A. Hyperkalemia. B. Fluid volume excess. C. Hyponatremia. D. Hypovolemic shock. Answer: D. Hypovolemic shock. Rationale: DI causes massive water loss leading to severe dehydration and hypovolemia. Question 7. A client receiving heparin develops a sudden platelet drop from 250,000 to 90,000. What is the nurse's priority action? A. Continue heparin. B. Stop heparin immediately. C. Administer vitamin K. D. Draw PT/INR. Answer: B. Stop heparin immediately. This suggests heparin-induced thrombocytopenia, HIT, which is life-threatening. Question 8. A client with DKA is receiving IV insulin. Which finding indicates treatment effectiveness? A. Blood glucose 250 milligrams per deciliter. B. Urine ketones negative. C. Serum potassium 3.0 milliequivalents per liter. D. pH 7.25. Answer: B. Urine ketones negative. Rationale: Resolution of ketoacidosis, not glucose alone, indicates effective treatment. Question 9. A client with acute pancreatitis reports severe abdominal pain unrelieved by opioids. Which complication should the nurse suspect? A. Ileus. B. Hypocalcemia. C. Pancreatic necrosis. D. Ascites. Answer: C. Pancreatic necrosis. Rationale: pain unresponsive to opioids suggests worsening inflammation or tissue death. Question 10. A client with myasthenia gravis has increasing weakness and difficulty swallowing. What is the priority intervention? A. Administer anticholinesterase. B. Prepare for plasmapheresis. C. Keep NPO and suction equipment ready. D. Administer corticosteroids. Answer: C. Keep NPO and suction equipment ready. Rationale: airway protection is the priority due to aspiration risk. Question 11. A client with SIADH is most likely to have which assessment finding? A. Dry mucous membranes. B. Decreased urine output. C. Elevated sodium. D. Weight loss. Answer: B. Decreased urine output. Rationale: SIADH causes water retention and dilutional hyponatremia. Question 12. A client with chest trauma has tracheal deviation and absent breath sounds on one side. What is the nurse's priority action? A. Apply oxygen. B. Notify provider. C. Prepare for chest tube insertion. D. Obtain chest X-ray. Answer: C. Prepare for chest tube insertion. Rationale: findings indicate tension pneumothorax requiring immediate decompression. Question 13. A client with Addison's disease is experiencing vomiting and hypotension. Which medication should the nurse anticipate? A. Furosemide. B. Hydrocortisone IV. C. Insulin. D. Levothyroxine. The answer is B. Hydrocortisone IV. This is an adrenal crisis requiring immediate corticosteroid replacement. Question 14. A client with a bowel obstruction has high-pitched bowel sounds. What does this indicate? A. Paralytic ileus. B. Resolving obstruction. C. Early mechanical obstruction. D. Peritonitis. The answer is C. Early mechanical obstruction. High-pitched sounds occur when intestines are hyperactive against obstruction. Question 15. A client with sepsis has BP 82/48 mm mercury after fluid resuscitation. Which medication should the nurse anticipate? A. Dopamine. B. Norepinephrine. C. Digoxin. D. Propranolol. The answer is B. Norepinephrine. First-line vasopressor for septic shock after fluids. Question 16. A client with acute urinary retention is most at risk for which complication? A. UTI. B. Hydronephrosis. C. Bladder rupture. D. Acute kidney injury. The answer is D. Acute kidney injury. Back pressure from retention can impair renal function. Question 17. A client receiving TPN develops fever and chills shortly after infusion begins. What should the nurse do first? A. Slow infusion rate. B. Stop the infusion. C. Administer antipyretics. D. Change tubing. The answer is B. Stop the infusion. Suspected catheter-related bloodstream infection. Question 18. A client with Guillain-Barré syndrome is most at risk for which life-threatening complication? A. Renal failure. B. Autonomic dysreflexia. C. Respiratory failure. D. Seizures. The answer is C, respiratory failure. Descending paralysis can affect respiratory muscles. Question 19. A client post-thyroidectomy reports tingling around the mouth. What is the priority action? A. Administer calcium gluconate. B. Check blood glucose. C. Reassure client. D. Administer levothyroxine. The answer is A. Administer calcium gluconate. Signs of hypocalcemia from parathyroid injury. Question 20. A client with atrial fibrillation is started on warfarin. Which lab value requires immediate follow-up? A. INR 3.8. B. Hemoglobin 13 grams per deciliter. C. Platelets 180,000. D. Potassium 4.0 milliequivalents per liter. The answer is A. INR 3.8. INR above therapeutic range increases bleeding risk. Question 21. A client with spinal cord injury above T6 develops severe headache and hypertension. What is the nurse's priority action? A. Administer antihypertensive. B. Sit client upright. C. Assess for bladder distension. D. Call rapid response. Answer C. Assess for bladder distension. Rationale: autonomic dysreflexia is commonly triggered by bladder distension. Question 22. A client with heart failure is prescribed spironolactone. Which lab value is most important to monitor? A. Sodium. B. Potassium. C. Magnesium. D. Calcium. Answer B. Potassium. Rationale: spironolactone is potassium sparing and may cause hyperkalemia. Question 23. A client with sickle cell crisis reports chest pain and shortness of breath. What complication is suspected? A. Pulmonary embolism. B. Acute chest syndrome. C. Pneumonia. D. Myocardial infarction. Answer B. Acute chest syndrome. Rationale: a leading cause of death in sickle cell disease. Question 24. A client with acute glomerular nephritis is most likely to have which finding? A. Polyuria. B. Proteinuria. C. Hypernatremia. D. Hypotension. Answer B. Proteinuria. Rationale: glomerular damage allows protein leakage. Question 25. A client receiving chemotherapy has ANC of 400. Which intervention is priority? A. Limit visitors. B. Administer vaccines. C. Encourage raw fruits. D. Discontinue chemo. Answer A. Limit visitors. Rationale: neutropenic precautions prevent infection. Question 26. A client with peptic ulcer disease suddenly develops rigid abdomen and severe pain. What complication is suspected? A. GI bleed. B. Bowel obstruction. C. Perforation. D. Gastritis. Answer C. Perforation. Rationale: rigid abdomen indicates peritonitis. Question 27. A client on digoxin reports nausea and visual halos. Which action is priority? A. Give antiemetic. B. Check digoxin level. C. Administer potassium. D. Continue medication. Answer B. Check digoxin level. Rationale: classic signs of digoxin toxicity. Question 28. A client with pneumonia has RR 32 per minute and SpO2 88% on room air. What is the nurse's first action? A. Obtain ABGs. B. Apply oxygen. C. Administer antibiotics. D. Obtain sputum culture. Answer: B. Apply oxygen. Rationale: airway and breathing take priority. Question 30. A client with burns covering 40% TBSA is most at risk for which early complication? A. Infection. B. Fluid volume deficit. C. Hyperkalemia. D. Contractures. Answer: B. Fluid volume deficit. Rationale: massive fluid shifts occur in the first 24 to 48 hours. Question 30. A client with Cushing's syndrome is most likely to exhibit which finding? A. Weight loss. B. Hyperkalemia. C. Moon face. D. Hypoglycemia. Answer: C. Moon face. Rationale: excess cortisol causes characteristic fat redistribution. Question 31. A client with pulmonary embolism suddenly becomes hypotensive. What is the nurse's priority action? A. Administer morphine. B. Apply oxygen. C. Start IV fluids. D. Notify provider. Answer: B. Apply oxygen. Rationale: oxygenation is the immediate life-saving intervention. Question 32. A client with ESRD is scheduled for dialysis. Which medication should be held? A. Erythropoietin. B. Insulin. C. Antihypertensive. D. Phosphate binders. Answer: C. Antihypertensive. Rationale: risk of hypotension during dialysis. Question 33. A client with meningitis has a sudden decrease in LOC. What complication is suspected? A. Sepsis. B. Increased ICP. C. Dehydration. D. Stroke. Answer: B. Increased ICP. Rationale: sudden neurologic decline indicates rising intracranial pressure. Question 34. A client with alcohol withdrawal develops hallucinations and tremors. What medication is priority? A. Haloperidol. B. Diazepam. C. Propranolol. D. Phenytoin. Answer: B. Diazepam. Rationale: benzodiazepines prevent seizures and DTs. Question 35. A client with GERD should be taught to avoid which food? A. Oatmeal. B. Lean chicken. C. Chocolate. D. Bananas. Answer: C. Chocolate. Rationale: chocolate relaxes the lower esophageal sphincter. Question 36. A client with hyperthyroidism is most likely to have which symptom? A. Bradycardia. B. Heat intolerance. C. Weight gain. D. Dry skin. Answer: B. Heat intolerance. Rationale: increased metabolic rate causes heat intolerance. Question 37. A client with acute MI reports chest pain unrelieved by nitroglycerin. What is the next priority medication? A. Aspirin. B. Morphine. C. Heparin. D. Metoprolol. Answer: B. Morphine. Rationale: morphine reduces pain and preload when nitrates fail. Question 38. A client with liver failure develops ascites. Which medication is commonly prescribed? A. Lactulose. B. Furosemide. C. Propranolol. D. Metoclopramide. Answer: B. Furosemide. Rationale: diuretics reduce fluid accumulation. Question 39. A client with rheumatoid arthritis is on long-term corticosteroids. Which complication is expected? A. Hypoglycemia. B. Osteoporosis. C. Bradycardia. D. Hyperkalemia. Answer: B. Osteoporosis. Rationale: steroids decrease bone density. Question 40. A client with DVT should avoid which action? A. Ambulation after anticoagulation. B. Leg elevation. C. Massage of affected leg. D. Compression stockings. Answer C. Massage of affected leg. Rationale: massage may dislodge the clot. Question 41. A client with hypoparathyroidism is most likely to have which electrolyte imbalance? A. Hypercalcemia. B. Hypocalcemia. C. Hypernatremia. D. Hypokalemia. Answer B. Hypocalcemia. Rationale: low PTH decreases calcium levels. Question 42. A client with status epilepticus requires which immediate intervention? A. Oral anticonvulsants. B. IV benzodiazepines. C. CT scan. D. EEG monitoring. Answer B. IV benzodiazepines. Rationale: stops continuous seizure activity immediately. Question 43. A client with acute liver failure is at highest risk for which complication? A. Hypoglycemia. B. Hypercoagulation. C. Hypertension. D. Polycythemia. Answer A. Hypoglycemia. Rationale: liver cannot perform gluconeogenesis. Question 44. A client with an NG tube has absent bowel sounds. What should the nurse do? A. Remove tube. B. Clamp tube. C. Continue suction. D. Start enteral feeding. Answer C. Continue suction. Rationale: absent bowel sounds indicate ileus or obstruction. Question 45. A client with metabolic acidosis will have which compensatory response? A. Hypoventilation. B. Hyperventilation. C. Bradycardia. D. Renal retention of CO2. Answer B. Hyperventilation. Rationale: blowing off CO2 compensates for acidosis. Question 46. A client with acute pericarditis should be positioned how? A. Supine. B. Trendelenburg. C. Sitting upright and leaning forward. D. Side lying. Answer C. Sitting upright and leaning forward. Rationale: reduces pericardial pressure and pain. Question 47. A client with bowel resection has absent bowel sounds 48 hours post-op. What is the priority nursing action? A. Administer laxatives. B. Notify provider. C. Encourage ambulation. D. Insert NG tube. Answer C. Encourage ambulation. Rationale: promotes return of bowel function. Question 48. A client with chronic steroid use is scheduled for surgery. What must the nurse anticipate? A. Increased insulin needs. B. Stress dose steroids. C. Antibiotic prophylaxis. D. Fluid restriction. Answer B. Stress dose steroids. Rationale: prevents adrenal crisis during stress. Question 49. A client with heart failure has crackles and weight gain. Which medication addresses the cause? A. ACE inhibitor. B. Beta blocker. C. Diuretic. D. Digoxin. Answer C. Diuretic. Removes excess fluid causing congestion. Question 50. A client with traumatic brain injury has worsening headache, vomiting, and unequal pupils. What is the priority action? A. Administer analgesics. B. Elevate HOB. C. Prepare for CT scan. D. Notify provider immediately. Answer D. Notify provider immediately. Signs of increased ICP and possible herniation require immediate intervention.